Hello everyone. On this episode, we're going to be discussing the X-ray and the new technology that's evolving around the scoliosis diagnosis and evaluation and assessment. Of course, the X-ray is still by far the golden standard for our patients and our practice, including the posterior anterior view for the full spine and lateral view for the full spine, but will include the neck, the hips, and the femur head, which is so critical, and we're going to know why and how. On the BA view, the full spine, we obtain curve measurements, the key vertebrae. When I'm saying the key vertebra, I mean the apical vertebra, the most inclination level on certain vertebra, the rotation on the particular vertebra. So those are the key vertebra that we can determine by the P2A view on the X-ray. Of course, on the rotation, we use the Nash and Moe. We also could obtain the morphological exam or the morphological disorders, number of vertebra, if there's an extra number, if there's a wedge vertebra, butterfly vertebra, all the morphological changes that happens on certain type of scoliosis. It's very easy to determine, and this is maybe the only way to diagnose this particular disorders. We can also check on the rib fusion, rib counts, vertebral fusion, vertebral numbers, vertebral congenital anomaly as a step before we order an extra investigation or an extra tool to update or upgrade our diagnosis. On the lateral view, we have, as we mentioned before, we have to mention to the radiologist that we need, starting from the neck. When I say neck, I'm talking about the spinal cord, the vertebral column, cervical vertebra, including the hip, and most critical thing is the femur head, because we need to use the femur head is very important and critical for the sagittal parameters that we like the pelvic incidence, sagittal, sacral slope, pelvic tilt. All these parameters on the sagittal plan will allow us not only to diagnose certain things, but to follow up on our treatment with bracing, with exercise, with whatever. So on the sagittal parameters, of course, we check on our kyphosis, the patient kyphosis, our lordosis. We put our pelvic endings and sagittal endings, and the sacral slope, and all this main parameters on the sagittal profile for the importance of the follow-up on the sagittal profile in any scoliotic patient. After that, we moved up to a new technology. I think it was in the market starting in 1992, if I'm not mistaken, between 1992 and 1996, something like that. Is the 4D optical imaging system. And there's lots of good advantage on this particular technology because it's typically it depends on the topography of the anatomical landmark on the body, the external anatomical landmark like C7, T1, T12, scapulae, all this PSISs. All this by the video raster stereography. What we do, it makes black and white striation, as you see here, externally, so it's non-invasive, cost-effective, and it uses an anatomical landmark. And by doing the optical imaging system using this landmark on the external body with a computer software, we could build an we could build an imagination about how the body is posture and how the body is tilted, how the body is. It gives us a lot of information on the vertebral column situation too, in relation to the anatomical landmark. Again, they use it a lot in the postural studies, and also they use it on the bracing manufacturing. Because of this particular advantage, it's non-invasive and it's cost-effective, and it's easily to be done on the clinic. You know, it's the optical imaging system is it's easy device. It has certain rule that to follow just to get the accurate measurement, and it's a wonderful tool for the follow-up with scoliosis treatment for any patient, lowering doses and all this nice stuff. Then we have, in my opinion, like the best thing that's happening now on the diagnosis of the scoliosis is the EOS. The EOS is simply a double X-ray, one from the front and one from the side. But the advantage is, instead of taking the BA separately on the regular, ordinary, traditional, conventional X-ray, and then take the lateral view shot, no, these two shots is simultaneously go together, BA and lateral simultaneously together. That's number one. Number two, it's the patient is standing in the upright position spine, so the spinal cord and the vertebral column are aligned, all the weight bearing are effective, and it's in the shot, so we can do the relationship, we can know the relationship between the vertebral column bone and all the skeletal muscle attachment to it in a weight bearing, gravity, normal position. Then it's one scan, goes one scan, and it's very less, it's of course non-invasive, and it's very less radiation dose for our patients. And as you see, we get here we get the B to A shot along simultaneously with the lateral shot, and by a software on the machine, it creates a 3D X-ray photo right here, so will give us like the best outcome from one simultaneously shot for the patient in a standing upright spine, which is very important in a scoliosis patient. The only thing that this particular technology takes, the shot takes like between 16 to 18 to 20 seconds, so we want to make sure that the patient is static, is not moving. So that's why it's not convenient for juvenile or infantile scoliosis. The kids under, I will say under 3 or 4 or 5, they will be moving around. It's very tough to get the right image from them, but it's wonderful technology, and it's one of the best things that's happening in the scoliosis world. Then we came to the wonderful 3D CT. Of course, we have the SET scan, the CT scan. Then we have the computerized tomography on the 3D, which allow us, and here, for example, to give us the actual model. It makes the actual model by software for where, and all the best. The CT is always the best to catch the bone deformity, not the software or the musculoskeletal, muscular system. No, the bone itself. Any deformity in the bone, as you see here, you can see it as the patient is open. You think the patient is open, and you can see it like you're making an open surgery. So the bone deformity is the 3D CT is the best thing to determine the bone deformity in certain particular, for example, congenital clipophile, congenital non-fusion of the vertebrae, wedge vertebrae, butterfly vertebrae. All this nasty, deformities or congenital deformities, disorders, could be detected perfectly and evaluated by the 3D CT scan. Then, of course, we have the MRI and the standing MRI in certain people, the people that suffer the phobia from the MRI, the laying MRI. And we have the 3D ultrasound, which includes 3D fetal assessment in certain particular congenital scoliosis, and if we need an early assessment. But as all you know, the MRI could be like a necessity in certain type of congenital malformation, or for example any CNS dysfunction, syngomyelia, any nerves involved. So MRI will last as the best alternate for the evaluation of soft tissue and skeletal system. Then we have another tool, which is a very good tool, the digital postural assessment, the 3D scanner. It's software hooked to the iPad, and we scan the patient in a certain way with certain technique, and it's simple and it's easy to learn. And this helps us in a lot in brace preparation, and a lot in when we prescribe exercise to follow up. It's just, it assists, and also for the vestibular assessment dysfunction, vestibular system evaluation. The digital postural assessment, it's very simple technology, 3D scanner, then goes software and it gives us 100% evaluation about the posture for this particular patient. If there is any vertebral collapse, is there any abnormal postural thing, any vestibular dysfunction, we obtain a lot of information from this simple and nice and non-invasive device. So it looks like we reached our last slide here. This channel is for all scoliosis and healthcare provider, all my friends PTs and MDs and DCs, orthotist, surgeon and nurses, and most important for the patient and its families. It fills a gap among different scoliosis clinicians through the scientific literature and research paper. That's our statement, and it's, my name is Wael Abdullah. I'm a medical doctor and a chiropractic doctor, and obtaining a master's degree on an Italian institute about a specific alternative non-invasive scoliosis treatment. Thank you for joining us, and hopefully we'll see you on the next slide.